Okay, how are you doing today? So I'm a student physical therapist from Henry Ford College, and this is Gabe, and he has suffered a full shoulder cuff tear, and we brought him through his physical therapy program, and he's doing a lot better now, and you made a lot of improvement, right?
Yeah, for sure.
So now we're sending him home, and this is going to be the home exercise program that we're giving him. So I just want to clarify, make sure he's clear with how to do everything. And so we're going to run through the HEP, or the home exercise program. So the very first thing I want to do is kind of a warm up. We call it 3-way shoulder raises. So with no weight, this is just to get the shoulders warmed up. I want you to sit here with good upright posture, and you're going to bring your shoulders to the side.
Okay.
You're going to bring them to the front.
Okay.
About 90 degrees, and then you're going to push them up like this. So that's the 3-way. So you got lateral, front, and then you're just going to push them up. And then we're going to do that for 10 reps, okay?
Sounds good. Is all three of them together count as one rep?
Oh, yep, that's
Okay.
right. That's exactly right.
Gotcha. All right, so here.
Yep, side. Good. Up, good. That's one, yep. Good, that's 2. Three. Good, and we'll just do one more for now.
Gotcha.
At home, I want you to do 10, but just for this, we're just gonna.
Just demonstrating.
Yep,
Gotcha.
just show you 10.
Okay. What do we got next?
Okay, great job. All right, so the next one, what we're gonna do is, I think that this is the money maker for all shoulder cuff exercises. This is the most important one in my opinion, and you'll see it all the time. And Gabe's already familiar with this because he's been through this in therapy. So you should be pretty good at this one. This one is the external rotation holding this band, okay?
Okay.
So the main things you want to think about when you do this one is you have to keep that arm locked at your side. In fact, it's good if you put something under your arm.
That's a cue.
Yeah, like if we had a towel or something, we don't have one right now, but we could put a little towel here under the side just to make sure, just a cue to make sure you're not lifting up, because you don't want to turn it into a lateral raise where you're moving this. You want to keep this at your side and just rotate away like this, okay?
Sounds good.
So,
I'm going outside to my left side.
yeah. So I'm going to hold the band for you,
Okay.
and you grip it like this, and yeah, good. Moving away, exactly. 2, we'll go for 10 to 12, 3, 4, good. And like I said, the main thing you want to think about here, just make sure this is tucked in. It's almost like if my hand is right here, he's squeezing my hand. Normally we'll put a towel right under here. If the towel falls on the ground, then that means that he's taking his arm away from the side too far. Okay, one more for now. Good. And then another thing we can do, we can flip that around and we can do it the other way. So I'll come over here,
Exactly.
and this is gonna focus on the subscapularis. And now he's just internally rotating the same thing, but he's going this way. Again, keeping this arm tucked all the way at his side and doing that. It's called internal rotation. And that's gonna focus on the other part of the shoulder cuff called the subscapularis. So we're gonna do each of these, and we're gonna go for 10 to 12 reps, and we're gonna do about 3 sets. We can do that 5 times a week. About 5 days a week would be good. Okay, one more, there we go, good job. All right, moving on. The next exercise, what we're gonna do is called D2 flexion, which is basically, it's a fancy way of doing this movement, which most people, you could call it sort of a sword pull, because it's like you're pulling a sword from the sheath, almost like this, like you're getting ready to, do a sword fight. So you want to start again with good posture, and posture is an important theme that you'll see reoccur a lot of time, because the main thing is you don't want to get into this forward, what we call kyphotic posture. If you notice, the shoulder cuff injury is a lot of time is based upon an impingement. It's associated with the impingement in the subacromial space, which all that means is that the space in the shoulder blade and the acromion, between the humerus and the acromion, is getting smaller, and the tendons in there from the rotator cuff and sometimes the bicep tendon, it's a pinching that's happening in here. So you can notice that if you go into this posture with your shoulders rolled forward and you try to raise your arms, you won't even be able to raise your arms. You could try it yourself, you can only get this far. Then when you go in this posture, with your shoulders set back nice and tall, you'll be able to raise your arms straight up. So through all these exercises, we want to keep that straight up posture, not forward, but nice and back with our shoulders back and nice and straight. So he's going to assume that posture, and you're going to do, again, like I said, a sword draw. So you're coming from this position, like your hand is at like a sheet, and you're pulling it out. Your thumb is going this way in a diagonal pattern up like this.
Okay.
Okay? And we're going to do that for 10 reps. Good. 3, 4, and one more for now should be good.
All right.
There we go, one more, good. Now, the next one that we're gonna do is called Y raises, and this is actually not directly for the shoulder cuff, it's more associated with the lower traps. So the lower traps are like this part of your back right here. And a lot of the time what happens is this part is really subject to getting weak and lengthened. And the pecs tend to get overstretched, again, when we get in this kyphotic posture. And this part of the back, this is associated with having good posture, like I was saying. So we're gonna strengthen up the lower traps. And also another thing with rotator cuff, and the research shows, is that the upper traps tend to be too active. So people tend to get a little shruggy. So when we're doing these exercises, that's another thing that's really important, and we'll speak to this again at the end. You don't ever want to see a shrug. So when he's doing any of these exercises like that has to do with lifting your arm, if you're shrugging like this, then you want to stop right away and fix that, because that means you're using your upper trap, which is right here, to elevate your arm and compensate and go like here, and this is not healthy for your shoulder. That's a lot of time associated with shoulder pathology and problems. You want to use your lower trap to raise the arm. So this one is going to focus and hit those lower traps. So he's going to go over the ball like this, and you can just lean on it like this, and then we call it Ys because you're basically doing a Y with your arm like this. Come up and squeeze just like this, okay?
All right. You want me to sit down and just rest down there too?
Yeah. Gotcha. That's good. Good, yep. Go in and you should feel it again. Keep going. And you're looking to feel it right here is where you should feel the contraction in your back. Now, because Gabe's already along pretty far in his rehabilitation, I can even progress him further by giving him a couple of, these are some 3-pound dumbbells. Now, don't start with this unless you've already progressed to this level, because it's going to make it a lot more difficult. But for him, because he's been at it for a while, he's able to do this. Good, give me 2 more. Good, that's it. All right, now for the next one, we're gonna hit another one of the important muscles, which is called the serratus anterior. So that muscle is right here, and it's an important muscle that it rotates the scapula, so it has to do with raising your arm up. Because if you know about anatomy, to raise your arm above head, you have to also, the scapula, which is this bone right here, has to rotate 60 degrees in order to have a good scapular humeral rhythm and raise your arm up. So sometimes there's some dysfunction and that's not working, and that can be due to the lower traps like we just talked about, or it can be due to this serratus anterior right here. So to focus on the serratus anterior, we're gonna do push-up plus. Now, were you doing it on the table?
Yeah.
Yeah, so we're doing it on the table. So what you do here, you keep the arm straight. And it's important you keep the arm straight. It's not a push-up. A push-up is this. I'm bending at the elbow. And this can be hard and difficult for a lot of people to get if they're not used to it, because you're not doing this. That's not what you're doing. Your arms are totally locked out, and the only motion is this right here. So you see my arm is straight. This motion is called protraction, scapular protraction. So I'm just, again, you're only gonna see a couple of inches of movement. It's just from here to here, that's all it is. And that's activating that serratus anterior. So go ahead and try that one. Again, notice his arms are totally locked out. No bend at the elbow. Yep, and he's just contracting. Keep going. So if you can see it, I don't know if you can see it, but right here, that muscle contracting, that's what you're looking for. Do a couple more reps of that. And this is called the push-up plus. And one more. Good. All right, that's good. So we're gonna do that for 10 to 15 reps. You can do 3 sets, and we can do that 5 times a week as well. Okay, now we've got 2 more to go. So for the next one, what we're gonna do is called thread the needle. And this is it's a bit more of a stretch, but what it's gonna do is it's gonna increase some thoracic motion. A lot of times the thoracic spine can get really stiff, and that can also cause some dysfunction. So it's gonna open up the thoracic spine. So it's called thread the needle. So what you do is you get in this position, a good neutral spine, and you're gonna reach through, and then you're gonna open up like this. You'll feel it, the further you bring your legs up, you'll feel even more. So again, through and up like this.
I'm sorry, the last time.
Yeah. Good. Opening up that thoracic spine, increasing some mobility there. Good. Give me 3 more. 1, 2, 3. Good. All right. Now we're almost done here. We got one more for you, and this one is a stretch. So as I spoke to earlier, one of the dysfunctions of the shoulder, it has a lot to do with the kyphotic posture, which is when you're rounded this way, and a lot of times that's associated with rounded shoulders, which is associated with tight pecs, especially for people that tend to bench press a lot. They like to work that chest, and they don't work lower back. Their chest will shorten. And what does the chest do? If A ducks the arms, it closes them this way. So the stronger the chest is, we tend to get in this of a posture. So we're just gonna reverse that. We're gonna open it up and open that chest up, and you can do it. It's called the doorway stretch. You can also do it in the corner of a room like this. So you can go up here, and we're gonna put our arms at about this level, and we're gonna lean into it like this and open up that chest and hold that for 30 seconds, 5 times. So again, if you can't reach that high, then don't reach that high. You can reach lower. It's all to where your comfortability. You shouldn't feel any pain or anything like that. Just, lean into it for a nice, gentle stretch. And take some deep breaths. And we're gonna go for about 30 seconds. Now, after we do it for 30 seconds, we're gonna take a brief rest, and we're gonna repeat that 5 times. And again, we can do this 5 times a week to 7 times a week. Okay? Good, that's about 30 seconds. So go ahead and rest. And like I said, you would do that 5 times. For now, we'll just show that one, but we'll repeat that 4 more times. So that is gonna be your program for your home exercise program for your rotator cuff.
Not tease eyes on there real quick if you want.
Yeah, we can, but I think that it's enough for now. Okay. So what we could do is we could, just a couple other things we want to cover is, again, with that shrugging sign, one thing you want to look out for, especially if you go to the gym and you're doing any weights like this, is when they lift their arm and they're shrugging. Because you want to beware of that shrugging, because again, that's using the upper trap, and that's not what we want. We want to be able to keep the trap down and raise up like this without using our upper traps. That's a healthy way to do it. So when you're doing these exercises, no matter which one it is, whether it's shoulder presses, or if you're doing the D2 flexion, or if you're doing the Ys, you don't want to do them like this. You don't want to use your upper trap. You want to be in that good posture like this. Okay, and keep a good posture throughout the day. And what other thoughts do you think?
Yeah, just with that okay sign, I call it that shrug sign.
if they end up going to that point, just stop at that point until they build up the strength to have more scapular rhythm control, which takes time. So sometimes people won't be able to go that high to fully extend up. Just stop where they can do it normal and then go from there basically.
Right. If you can't reach all the way up like this, wherever that comes, then you might have to stop. Then just do that range of motion. When you do any of these exercises, it's important you keep them in a pain-free range of motion. You shouldn't feel any pain while you're doing any of this. Sometimes you might feel a slight discomfort. You say like on a pain scale, a level of 2 to 3 max, you can kind of work through it, it's okay. But if you're feeling anything more than that, like a sharp pain or a pain over 5, then just back off, because that's not gonna help you and that's not what we want, okay? Everything should be comfortable range.
And again, with all the exercises too, you don't need a lot of weight with them. It's more about making that mind-body connection and feeling it, isolating those muscles in the right spots.
That's right. Okay, so that's your home exercise program, and I want you to stick with that, and then let us know how that works out for you. From Henry Ford College, my name is John Dolph, and this is Gabe Orsia. Thanks a lot, and have a great day.